Now we're going to move on to drowning and water rescue. First, we need to discuss a few definitions in relation to drowning. In the past, a lot of people used the terminology drowning and near drowning, where drowning meant that there was respiratory arrest or loss of consciousness, whereas near drowning meant that you might have struggled a bit, maybe inhaled or aspirated some water, might be a little short of breath, but when all is said and done, you were awake the whole time. But we've gotten away from that two-term terminology or two definition terminology and pared it down to just one terminology or one word, and that is drowning. Some other phrases or words that are no longer used when discussing drowning are things like dry drowning or wet drowning. And the reason that we've been able to pare all this down to just one word is because at the end of the day, drowning is a continuum or a spectrum of disease. And that definition is defined as a process of respiratory impairment due to submersion in a liquid medium. And that spectrum or continuum starts with mild respiratory impairment and can progress all the way to cardiac arrest. And it's important to note that the definition utilizes the term liquid medium and not just water, meaning can you drown in ketchup? Absolutely. Has anyone? I'm not sure. And as I just mentioned, the spectrum or continuum starts with mild respiratory impairment and will continue and ultimately result in cardiac arrest unless it is interrupted. Now, we've already talked about how we no longer use the terms near drowning, dry drowning, or wet drowning, but what about differentiating between a freshwater drowning and a saltwater drowning? In the past, people were very concerned whether a person had been submerged in freshwater or saltwater. And a lot of that came about because of one theory. And that theory was that fresh water, being hypotonic, caused an influx of water into the vascular space, which resulted in fluid overload and electrolyte imbalance. Conversely, salt water, being hypertonic, caused fluid shifts into the alveoli, resulting in pulmonary edema. But when it's all said and done, the studies showed that salt water versus fresh water had no effect on patient outcome, because ultimately it's all about the continuum and all about hypoxia, which we're going to discuss. Additionally, the amount of water that someone aspirates during a drowning incident is usually not large enough to affect major change in their electrolytes or fluid status. The only place that this is not the case would be if someone were to drown in the Dead Sea. So at the end of the day, freshwater and saltwater still rely on that continuum. So let's do a quick recap. We've said that we no longer use the term dry drowning, wet drowning, or near drowning, and that there's no difference if someone has a drowning incident in a freshwater or saltwater body. So let's move on to epidemiology. To the left of the slide, you can see several risk factors that are directly linked with drowning deaths. Annually, in the United States, there are 4,000 deaths from drowning. Worldwide, that number is 500,000, 500,000 drowning deaths. And there's a pretty stark difference between males and females in relation to drowning deaths. Females have their highest risk of death only in their early years. Quickly after, they will taper off to lower levels. Males, however, have a bimodal pattern of death or disease. This is likely due to the fact that as males enter their teenage and young adult years, they're more prone to engage in risky physical activity. And if you combine said activity with the use of alcohol, you'll get what a lot of people refer to as the hold my beer phenomenon. One other thing to note is that home pool is a risk factor. A lot of people believe that having a pool at home will make their children better swimmers and put them at less risk of a drowning death, but what it actually does is gives young children easy access to a large body of water. So what exactly happens when you drown? To pare it down into the most simplest of terms, it is hypoxia. And when you have hypoxia, you will get cardiac ischemia and dysrhythmia, and you will get neurologic injury. Now, if we want to get to a deeper meaning of what happens or a deeper understanding of what goes on during a drowning incident, I've created this slide to sort of go through the steps. When someone begins a drowning incident, it usually starts with a panic or a struggle to stay above the surface of water. During this process alone, some water may be aspirated into the lungs. Ultimately, as a person finds themselves unable to stay above the level of water, they will take a large breath just before their head goes underwater. They will then hold this breath until they're able to get above water and take another breath. If for some reason they're unable to get above the surface of water to take another breath, eventually the inspiratory drive by the brainstem will be too strong to voluntarily overcome, and what is known as an involuntary breath is taken. This involuntary breath is determined by the PaCO2 and PaO2 levels within the bloodstream. Now, it may just be a small aspiration that occurs during this involuntary breath, but it usually will provoke a coughing reflex or a vomiting reflex, or in some cases, laryngospasm. After the vomiting episode, coughing episode, or laryngospasm, the person will usually take another voluntary or involuntary breath. As this process continues, eventually there will be an overall lack of oxygen, which results in hypoxia. Now, I should note that the laryngospasm event generally is pretty rare, and when it does occur, it is only temporary and will fail once hypoxemia reaches a critical level. This laryngospasm is what a lot of people used, or what caused a lot of people to coin the phrase dry drowning, because the lungs would only be filled with a small amount of aspirated water because of the laryngospasm, but at the end of the day, the hypoxia is the same. So we talked about what actually happens to a person while they're going through the process of drowning, but let's focus a little bit more on the organ systems themselves. So I have this pathway that shows what will generally occur, starting with aspiration at the top and ending with hypoxia. And there's a couple ways that this can occur utilizing the lungs and the nervous system. So to cover this very briefly, when you aspirate, one of two things happen. You'll stimulate the vagal nerve, or you'll cause a small amount or a moderate amount of surfactant washout of the lung surfactant. If you stimulate the vagal nerve, this will result in vasoconstriction and pulmonary hypertension, which will ultimately end up with a ventilation-perfusion mismatch in the lungs. If you wash out the surfactant, you'll get stiff lungs, as well as atelectasis, which will also result in a ventilation-perfusion mismatch. And at the end of the day, when you have a ventilation-perfusion mismatch, you end up with hypoxia. We've already talked about how hypoxia comes about during a drowning event. Now let's talk about its overall effect on a human body. Hypoxia can result in cardiac ischemia and dysrhythmias. We've already established that. Specifically, those rhythms will be ventricular fibrillation or ventricular tachycardia. It can also have chronic and prolonged neurologic injury in survivors. In fact, 12 to 27% of survivors will have some chronic neurologic deficit related to the hypoxia during drowning. It can also have interesting effects on a patient's pupils. It's been noted that 10 to 20% of drowning survivors had transiently fixed and dilated pupils during the rescue event. That sort of goes against some of our classic teachings during resuscitation and ACLS that fixed and dilated pupils represent brain death. So you have to sort of keep that in consideration during a rescue event of a drowning victim. In general, thankfully, other organ systems are unaffected, but in severe cases of hypoxia and acidosis, a person can develop DIC, hemolysis, and ATN. The last topic I'd like to discuss in this first portion of the diving and rescue presentation is free diving. Free diving has gained popularity over the past several years to decade, but along with it, its complications and injury. Free diving is when a diver takes a single breath and swims straight down, usually following a guideline. They're not supported by any scuba tanks or breathing apparatus. It is a solo descent. The current record depth is 214 meters, which is 702 feet. And while records are hard to come by, it is estimated that there were 60 deaths in 2008 amongst freedivers. How freedivers are able to achieve such depths without needing to breathe is through the process of pre-hyperventilation. Prior to descending, they will hyperventilate, and what this does is it lowers their PaCO2 but leaves the PaO2 relatively unchanged. And if you remember, a lot of that involuntary breathing that we discussed in one of the previous slides, that involuntary breath is often driven by the PaCO2 levels when they rise to a certain level. So if you start with an extremely low PaCO2 in the bloodstream, you're less likely to feel the involuntary breath at a time when most normal people without hyperventilating would feel it. But the complications arise from the fact that you're undertaking a strenuous activity, so you are consuming the oxygen that you've built up in your system. And you lack that respiratory drive, so ultimately you do develop hypoxia. And with hypoxia, you can get all those problems. There have been seizures reported underwater, dysrhythmias, loss of consciousness due to cerebral hypoxia, and of course, death. So hopefully you've already watched the presentation on dive medicine and physiology so that this final slide will make more sense. But if you haven't, hopefully it will at the end of the presentation. So let's go through some of the 4 more common problems that are associated with scuba diving. Starting with pneumothorax. Is a pneumothorax likely when someone is free diving? No, it's not likely. When you take that breath and fill your lungs with air at the surface and then dive down and then ascend, you're going to have the same amount of air in your lungs that you started with. You're not taking any extra air that you would do if you were diving with the scuba system. So pneumothorax is not really a common problem in the dive community related to freediving. But what can occur is something known as lung squeeze. And that is as you are diving, as you're descending, at extreme depths, the gas or air in your lungs continues to compress, but the surrounding tissue of the lung can't compress anymore. It's tethered to the chest wall and cannot continue to get smaller. So what happens is the blood vessels in the pulmonary system become engorged. And then there is microtrauma around those blood vessels causing pulmonary edema. The phenomenon of lung squeeze is almost exclusively seen in free diving, and ultimately its long-term effects or morbidity and mortality is unknown. Moving on to nitrogen narcosis. Is that something that can occur during free diving? Absolutely. You're going to extreme depths, but you're there for such a short period of time that many will argue that the effects tend to be very limited. What about decompression sickness? Again, people argue that you're there for such a short time that you're unlikely to develop that buildup of nitrogen in your tissues. So overall, it's unknown to the extent which decompression sickness will occur. And normally when you're scuba diving, you would ascend slowly and have a safety stop to allow any nitrogen buildup in your tissues to dissolve back into the bloodstream and then be exhaled. But when you're free diving, you don't have the luxury of having a safety stop or a slow ascent because you don't have any more oxygen in your system. You just need to get to the surface. So it's likely that we're seeing some level of decompression sickness in these patients or in these free divers, but ultimately the numbers are unknown. And finally, the ear, mask, and sinus squeeze can also occur in free diving just as it would in a scuba diver because you're having your sinuses compressed, the air in your mask, and the air behind your tympanic membrane. So there's no difference with the ear, mask, or sinus squeeze in free divers.